So, good morning, everybody. It's 11 o'clock. I like to start on time, and I hope you can all hear me. I'm Tony Variant. I'm the president of the HLAA Mission Viejo Chapter. And just so you know, this meeting is being recorded and it will be posted on our YouTube channel. And I want to thank our sponsors. But before we do that, just a couple of little things. You can turn on your captions by clicking the CC button and then click on subtitles. You can increase the font size using the settings provided. And in order to answer your questions, please use the raise hand feature. So in your toolbar down below, there is an icon called reactions. You want to click on that and then click on raise hand. And one of the best things, not only will I know that you have a question to ask, but it'll show up in order of who raised their hand first. So, okay. I want to thank Caption Call, who is a sponsor of this meeting and provides the funds for our captioner. And Caption Call provides a variety of products. They have a landline phone, physical phone. They'll provide captions for your iPhone or your Android and provide captions on and telephone calling on your iPad, which is really great, especially if you're traveling. You can use the phone with confidence. There's no landline needed. There is a new feature now where if you don't have a landline, one can be provided for you. Internet is not needed. They have a hotspot that they'll provide. And all you need to do is call and order one. And that's the phone number, 800-557-2227. Joe Gale is providing captions for us today. Hi, Joe. She's in Chicago, Illinois, all the way, providing captions. So we appreciate that. Amazing Hearing is Anne Mundell Noel. She's here at the meeting. She is our audiology advisor for the chapter and has been since, I think, at least 2013, 9-10 years, long time. And she's located in the Trader Joe's shopping center, and she will be here today to answer questions that she may be able to answer. So regarding sudden hearing loss. There is a chat function on your toolbar, and if you pull that up, you can send a message to Alan Katsura. He's our technical support, and he can assist you. Okay, so the Hearing Loss Association of America, that's my name, that's my email address, and that's our website. Okay, and I believe that is it. Stop. Okay. I did want to say that at any time during this presentation, it's a conversation more than a presentation. At any time, Dr. Hamid Dajilian may, from UCI, may appear to answer medical questions about sudden hearing loss, or his associate professor, Harrison Lynn. This is a busy schedule for them for surgery today. But they have promised that if they get a break, they will pop in. So they have the information to do that. And now I want to introduce to you Daniel Boone, who is here today to talk to us about his experience with sudden hearing loss. And sudden hearing loss, and he can describe his experience, but sudden hearing loss is something like today you hear and tomorrow you don't. Or this morning you heard, but this afternoon your ear went deaf. Maybe one, maybe both. Usually it's just one, but it is an emergency. It should be looked at as soon as possible. So I'm going to introduce you to Daniel, and Daniel is has been a friend of mine for literally 10 years, and so I've known him for a long time, and he's really had a struggle with sudden hearing loss, and he's a resident here at Laguna Woods Village. And so, Daniel, if you'd like to take the microphone and talk to us.
Do my best. For what it's worth, I've now had sudden hearing loss for my second time. And that about 8 years ago, I went to Hear USA for a hearing test. And the audiologist said, you have no hearing in your right ear. And they immediately called Kaiser for an appointment. The ENT specialist at Kaiser had significant, said I had significant drainage in my right ear, but not to the, I lost my way. But anyway, the specialist at Kaiser said I had significant hearing loss in my right ear and inserted a drainage tube for it to drain, and it drained for quite some time. It seemed like I had that thing in there forever. But the hearing did come back to some degree, but not to the level where it had been. And again, about the 1st of July this year, I sensed that the volume and clarity in my hearing was reduced somewhat. So I have tubes in my hearing aids rather than wires, and occasionally moisture gets in those tubes, and I've learned to have to go in and have the audiologist blow them out or replace them. I went to Amazing to change the hearing aid, the tube, but she found no blockage, and so a hearing test was made, and what do you know? I had hearing loss, sudden hearing loss again, and I was told to see a specialist because the audiologist can't do that. So the next morning, I called Kaiser for an appointment. Even though the nurse that I talked to understood the urgency, she said that we have no openings for you for 3 weeks. So I went to Kaiser's urgent care. There was no specialist there, but the nurse that I talked to understood the need for urgency, and she tested what she could and then called Kaiser's appointment center. She was able to get me an appointment in 5 days, which I'm thankful for. The Kaiser audiologist hearing test confirmed the hearing loss I had, and I saw a doctor the same day. The doctor prescribed 3 medications for me to take and then inserted some medication into my ear. And by the time I got home, I could hear. I thought that was quite amazing. However, the next morning I couldn't hear again. However, in short order, the hearing returned, and it's been there since, even though not at the level that it had been. At my next appointment at Kaiser, the doctor inserted a very small camera through my ear. Who knew? And he said, well, you used to have significant blockage remaining, and then put a hole in through my ear to create blockage, to create drainage, and told me to blow my ear, hold my nose real hard and blow hard, very hard, 10 times a day. I learned you have to take the hearing aid out to make that effective. And I do mean hard. This was, I lost my place. As of now, I can hear sound in my right ear, but not with clarity unless I get full volume, which can be uncomfortable in the other ear. I'll still be seeing the audiologist for quite some time until they tell me that there's no more improvement we can make. Now, what's the most important thing I can convey from my experience? It's simply to, if you sense some loss of volume or clarity, call your audiologist, talk to them. They know how to advise you, because it might cost you a hearing aid test, but it's a hell of a lot less than losing any more of your hearing. That's about the size of my experience, and I'm sure Ann can give you a whole lot more information about sudden hearing loss than I can. Hello.
Do you want me to?
Well, anybody.
Go in.
Anybody.
Okay. So just to kind of clarify for Daniel so that you get an idea, he has a severe hearing loss in both ears. So he's got a significant loss, and his right ear, when he had the sudden hearing loss the first time, I saw him right after that had happened. And it seemed to be more the eustachian tube coming down his throat that was contributing to the hearing loss. Somehow it suddenly plugged up. He got fluid in the ear, and that caused the loss of hearing. So it was a physical issue. So that's why they put the tube in his ear, and he got drainage, and it took a long time, but his body finally recovered, and he no longer needed the tube, and he had pretty good hearing over there, relative, right? So we're still talking about most of you having that moderate to severe level of hearing. You can imagine that if all of a sudden one side went down, even though it wasn't great, it really is going to significantly impact you. So this time when he got the sudden hearing loss and he came in and we tested his hearing, he had 0% understanding on that right ear. Previously, he had about 60%. So he went from 60 to 0, and that really threw him. Daniel, did you have balance issues? I don't recall if you had vertigo or balance issues when you lost the hearing on the right side.
I have balance issues anyway.
Correct. I get that. But I mean, was it more impacted when you lost the hearing?
I can't say yes to that because I didn't pay attention to it.
Okay. But the bigger part was that we tried to encourage him to stay on top of getting medical help, because had they put the shot in his ear, so they did what's called a transtympanic shot of steroids. They went through the eardrum and went into the inner ear and put steroids in there to try to stimulate the little hair cells in the inner ear. Studies have shown that if you do that within 24 to 48 hours, you can get almost total restoration if you're going to get it. The fact that he had to wait 5 days to get that shot, we're thankful that he got it at all and that some of the hearing came back. So again, I don't know where that would have been if he had gotten it earlier, but we do know where he would probably be if he didn't get the shot for the 3 weeks that they were initially suggesting. But the whole idea behind this now with him, they put the camera up his nose and checked his sinuses and the cavity and saw the blockage. He's now going back and trying to reopen his eustachian tube, that area between the middle ear and the outer ear. That is independent of the hearing loss that's in the cochlea. So he had kind of a double thing happening. The eustachian tube causing some blockage, as well as the nerve in the inner ear being damaged, probably from virus, some kind of a virus. And we don't know why, but that's why the steroids helped, is because it helped kind of counteract what the virus was doing.
And in that regard, just before that, I did have the virus.
You had kind of a cold or congestion?
No, I meant the
COVID?
The COVID.
Yeah. What you had the symptoms of what? What were your symptoms?
I didn't really have any.
So you didn't have any symptoms of
not to speak not to speak of. But
okay.
I was positive nonetheless.
Okay, so when you took it, okay, whatever the thought behind that is that he had a weaker system, and now the virus attacked the weaker area, and that caused the drop. The good news is that the hearing has come back to some degree. Does anybody have questions right now about any of that? Because I can talk about what would happen if he couldn't wear a hearing aid on that right ear. And we could talk about different things, whatever direction you guys want to go in.
One thing I would suggest to everyone, because my left hearing aid was good enough to mask the loss in my right ear, I don't know how long that was happening before I noticed it. So if you get any sense at all of loss of clarity, etc., talk to your audiologist.
So what we were able to do for Daniel is not only give a hearing test, but by doing real ear measurement, right? Putting a little microphone in your ear while you're wearing a hearing aid and measuring it, we could see if the hearing aid was still working the way that it was meant to. And when we did that and saw that the hearing aid on the right ear was still working, then we went and did the hearing test, which confirmed that there was a drop in hearing on the right side. So there are ways that you can very quickly assess if it's the hearing aid that's not working or if it's your actual hearing mechanism that's not working.
Is it a cochlear implant? Can you be candidate for cochlear implants? Maybe it will help, like cochlear implant.
So if a hearing aid is not sufficient for clarity, then you are correct, Rena, that maybe a cochlear implant could be helpful for him. At this point, his comprehension has come back to a point that he's maybe a borderline candidate for a cochlear implant, but more conservatively wearing the hearing aids, if he can get by that way, is the more conservative approach. But you are correct. If the understanding didn't come back, then one way would be to do a cochlear implant, but the conservative side would be using what's called a bicross hearing aid, putting a microphone on the dead side to work with a hearing aid on the other side so that you can hear still from both sides, even though the dead side doesn't get understanding, it gets sound awareness for people on that side. So there are a couple options, you're correct. Anybody have other questions, or has anybody else experienced a sudden hearing loss?
Does anybody have single-sided hearing loss? Just hearing loss on one side? No. Okay, Jeff, you have a question?
No, I don't have a question. I had a comment. I did have a sudden hearing loss overnight. What happened is, that was 2009. What happened was I had a cold, real bad cold, and the next day, all of a sudden, I lost the left hearing. Not only that, I suffered hernia as well. So my body would kind of, So I went to audiology in Anaheim, and they referred me to ear, nose, throat doctor. So first of all, before I go there, they test me. Okay, you're way down there. Then I went to the doctor. I had 5 or 6 days of sore. And after that, I thought, I don't think I got regained my hearing. I went back there with hearing. Yep, you all went back up there. Even didn't like it, but it did. So I had a sudden loss overnight because of real bad cold. Now I know that I had a hernia. I got to repair it anyway. That's all that happened. My body would go. That is my experience. So I still have not experienced since 2009.
So Jeff, do you feel like your hearing loss was because the eustachian tube was clogged and you had a cold versus, and it was like a temporary shift versus an actual nerve loss?
And now I don't recall. All I know, it was just sudden. I mean, after I got up and I thought, and I couldn't hear well in the meeting I used to, I said, okay, better check it out. I don't know if I don't think I felt around here. I just, this one is the weakest of the both, so I'm very fortunate. I have a strong right ear as compared to left, but I noted it different. I don't think I answered your question directly, but hopefully it's close enough.
Yeah, it sounds like Daniel's first experience when he had the congestion. Mm-hmm.
And not only that, I had it before, but I had it back the next day too, but this time it prolonged. That was 2009. That's because, again, I had a bad cold. And in a past, usually bad cold leads to my left ear. But now I haven't had it since. That's over, 13 years ago. Okay. Any other question about me? Okay, I'm done. Oh, yeah, Tony.
Okay. Joyce, your hand is up.
Yes, I just wanted to share that I do have single-sided hearing, and it's I've lost my hearing, total hearing on my left ear, and it was sort of gradual. I could see that I wasn't hearing clearly. We got tested. I got some hearing aids for both ears, and then all of a sudden I noticed that I wasn't hearing clear on the left, so I went in, and when we tested, they did see that I had lost the hearing on my left. So I was seeing an ENT, and he recommended the steroids, but we weren't sure how long, the time was since I lost it. So we weren't sure if that would help, but we tried it and it didn't. So I've been using a cross since then. And, I just have to be careful that I don't lose hearing on my right. And, so I have to try to avoid loud noises and, all of that. But it's, yeah. And I did go in to see, we were checking to see if I could have a cochlear implant, but because my hearing, it has to be at a certain level, right? And I forgot the percentage, but I'm above that. So Medicare wouldn't cover it or insurance wouldn't cover it. So I didn't go into the cochlear implant. And then I did this cross. But it's quite a challenge using the cross. I'm still not really happy because I really can't hear. Conversations are great. I can hear when I don't have a lot of background noise, but when we're at a restaurant or on a table with people, I can't hear, the voices. That's really frustrating.
Joyce,
Yes.
when you got this sudden hearing loss in the left ear, what was your age? What?
I'm trying to think. When was it? I guess I was in my late 60s. I'm trying to think how long this has been. I'm 81, and this has been for 10 years. So I must have been in my 70s when I was about 70, when I completely lost the left hearing. But prior to that, I was having problems hearing because I noticed that I would lose words when I put the phone to this ear. I was losing, things. Yeah.
I'm surprised that you didn't qualify for a cochlear implant. Anyway, maybe I can talk to you about that later.
Okay.
And if Dr. Jillian was here, he might be able to explain that, and he may pop in. So,
well, I will say that the standards for Medicare for cochlear implants have changed. So if you feel like you want to go and have that reassessed, that might be something to look at. The other thing is that in the previous days, the side that had the microphone on your left ear used to be what's called omnidirectional, and it used to just pick up sound from all around. So when you're in a quiet environment, somebody sitting on that weaker side, the microphone picks up the sound, moves it over to the good ear, and the good ear is actually doing the hearing. But the brain thinks you're hearing from both ears because the input on this hearing aid is getting two. It's getting one from the right, and then it's getting like a delay from the left. And we're talking milliseconds, so not a big delay, but the brain says, oh, it came in louder from this side, they must be over here. Oh, they came in louder here, it must be over here. So when you're in a quiet environment, that bicross is what it's called, or cross, there's two names to it, but anyway, it does well. It picks up and it starts to help the brain feel balanced. When you get into background noise, that omnidirectional microphone picking up sound from all around actually has been proven to pick up too much sound and kind of defeat the better hearing aid over here. And so a lot of people like Joyce have found that hearing and background noise was almost worse with a bicross hearing aid on, the microphone pickup, because the good ear was getting inundated with way too much noise. So what they have done now is with the bicross is they've gotten better, and that microphone pickup now can be directional and it's adaptive, meaning you don't have to do anything, but the hearing aid can detect, oh, there's a high level of noise. I'm going to go into a beam forming, more directional mode, and I'm going to be more interactive with the good side. So I just want you to know the technology keeps advancing, and a couple manufacturers are really getting good at the bicross. So I just want you to understand not all cross hearing aids are designed the same or function the same, just like hearing aids in general. You think they're all the same, but they are not. There is a reason they process differently. So you might check with whoever you are working with to see if they might be able to help you.
I do have the Oticon, and I did get those. It's been almost 2 years now, and I read about it and felt that they should be one of the better ones. But I'm still not really happy because I'm still, not able to feel like I'm hearing words. Yeah, and it's all partly having to train, right, my brain, and so it's a challenge, but I've been working at it. But I think I will call you and talk to you further. I'll give you a call and see, because it sounds like you do have more or know more about, helping.
Well, just in general, and again, I just went to our state conference over the weekend down in La Jolla, And it was a reminder, and you guys are great at this with this group because you rely so heavily on visual cues and trying to get the most out of your hearing. But it was a reminder that the hearing aid is an aid. It's not a cure-all.
Mm-hmm.
And just like with a cochlear implant, after you're implanted, you have to do extensive therapy to listen and train your brain how to hear and how to listen. And when people put hearing aids on, they think the hearing aid is going to do all the work for them. And that is, it's not correct.
Mm-hmm.
The hearing aid is getting better at distinguishing what is speech, which is very spiky, and what is background noise, which is steady state, and separating them out so that the speech and the noise are more distinguishable. But it's still up to the brain to do the work. So as the hearing aids get better, they're getting better to give you a cleaner, clearer signal so that the brain has a better chance for comprehension and understanding. But the listening, the understanding is happening in the brain. I can't change that as an audiologist. My job is to give you the most sound you can handle and accept, and then work with you to comprehend and get better. But therapy does work. So when Tony can talk, or our cochlear implant candidates can talk, that you have to do active therapy to train your brain to understand signals and not see it as noise, but see it as certain sounds in the English language. And that was just a reminder. I've got a lot of studies about when you do active therapy, how much better you can hold on to your comprehension. As poor as it might be, I will say Elkin is a prime example. He has worked tirelessly, hours and hours, on continuing to do hearing therapy, even though he's got a severe, profound loss and visual issues.
Okay.
Elkin, do you want to comment on that? You have to unmute yourself, Elkin.
Yeah.
Can you find the button? There
Sorry,
you go.
I have a little trouble with my visual loss seeing the cursor, so I couldn't get it to the microphone to unmute myself. And yes, doing the exercises is really very important. And I found it's helped me a lot because Anne has provided the Amplify hearing lessons for quite a while. And I used those extensively, probably more than anybody else in the class, and that helped. But as Anne said, it's not perfect. One has to keep at working at it, using whatever visual cues one can, and listening as best one can to everyone. And of course, I think we all of us with hearing loss do have more difficulty where there's background noise in a restaurant, no matter how good and advanced the hearing aids are. So it's always more difficult for all of us when there's background noise.
Yes, and that's because physiologically, it's not you, but in the brain, the ability to kind of hold down background noise and suppress it, physiologically, those mechanisms have been destroyed. And so that's why background noise affects people with hearing loss more than a normal listener. So normal listeners will say, yeah, it's loud in here, but you have a double whammy going. One, your hearing is more sensitive to loud sounds, but two, physiologically, the mechanism is not there to suppress the noise. So it is an active, ongoing project for you to stay engaged. And prayerfully, the way the hearing aids are working, they're doing a much better job suppressing the noise, but again, we're still working with a damaged system.
Tracy, I know you've got your hand up, but I'm going to ask Ann to mention a couple of things and then we'll get right to you. And Edward, I want to hear from you too. They both have indicated they have single-sided deafness. And there's more than one type of speech therapy for practicing. Amplify is one of them. And there are other programs. So can you just mention a little bit about what might be available? And I love what you say about, you know, when you go to the gym and you exercise your arms and, you know, and here you need to exercise your ears and your brain. And so what are the exercises that might be good?
Well, that is an area that is in transition right now in the audiology world. As Elkin said, there is a program called Amplify, and we have talked about it on this program. And I have offered it to patients free when we did hearing aids, and then continued the ongoing portion. But Amplify is a little complicated for a lot of people. It's kind of almost an overkill. There used to be a great Starkey Hear Coach app, and unfortunately they discontinued it. So I have to say that at this point, we are encouraging people to use the cochlear implant programs such as Angel Sounds and some of the other ones out there, because it's still it's just an evolving field that takes a lot of time, and there's very little, if no reimbursement for it. And so that area has not been fully developed. So unfortunately, the cochlear implant programs are more the ones that we're directing people to.
Thank you, Ann.
How about, I would ask, has anybody had successful cochlear implant using the therapy? You guys with cochlear implants, what programs have you found to be helpful? Anybody? The other part of that is, you know, we used to have Linda Daly, and then Penny Flaherty was doing the lip reading classes right before COVID. And a lot of people got benefit from the lip reading class, more for camaraderie of everybody having the same issue rather than really feeling like, oh my gosh, I'm a great lip reader now. I got the sense from most people that it was just about coming together with everybody struggling, kind of like this group, right? I mean, we're coming together because everyone has similar issues, but the therapy itself is very individualized, and that's what makes it hard.
Thank you, Ann. Okay, Tracy. Yeah.
Okay. First off, thank you, Ann, for providing additional insight. I lost my hearing in my right ear in February of 2021. And I've done numerous research, trying to do everything I possibly can to live my new normal, if you will. I do have a Bicross from Otakon. It's been frustrating. I switched over to Ann. I haven't seen Ann, and I've had one appointment with her associate, and that was extremely helpful. I started utilizing it, and then I went on vacation and just became frustrated because of the noise. I'm not used to all the background noise, still having trouble. And I feel I have to reduce my stress, and not wearing the Bicross helped. It's okay. Helped in that situation not to wear the Bicross. And now I'm leaning more towards a cochlear implant, but I'm not completely shut out of the Bicross. I have found adjusting the volume. Sometimes it would hurt my hearing ear because the volume would be really loud, and then I'd have to turn it down. And I became frustrated. So I assume that's fairly normal with other people. And I do hear Anne and everyone else, you got to keep trying, be your advocate. And it gets hard at times. And these groups are very beneficial. But that's my experience with the Bicross. I do qualify for a cochlear implant, but one of my questions and research that I'm going to be looking into is when I do retire and have to be on Medicare, what will be covered? So if Medicare is not going to cover, I don't know what they'll cover. I have no idea. But that's my next step in researching. I just want to make sure I have the means to ensure I can pay for whether it's an updated Bicross or getting the software enhancements on a cochlear implant. But
at this point, I believe if you qualify, Medicare pays for all of it. It's just your 20% that you're responsible for. Or if you have a supplement, they would cover that. Because it's a medical procedure. Because it's a medical procedure, they won't pay anything towards your Bicross hearing aids. It's a whole nother topic.
Oh, thank you. That's very helpful.
They don't.
I will maybe make an appointment to see you.
But just in general, they don't make anything in hearing aids. But because a cochlear implant is a medical procedure that requires the American Medical Association to be reimbursed, they are covered.
Okay, that's very helpful. Thank you so much. And I love these meetings. So thank you all.
Thank you, Tracy. Okay, Raina. Yes.
Yeah, hi. I just was wondering what Bicross is. I never heard of it. Can you explain it? And second, that only Articon has this, or does Videx has this feature too?
So, yep. So a Bicross, BICROS, stands for, the BI stands for bilateral, and then CROS stands for contralateral routing of signal. Whew, that's a lot of words.
Yeah.
The big idea is that you could have a cross, CROS, or you can have a bicross. If you have a cross, it means that you have one normal ear and one dead ear, and the sound from the dead ear is contralaterally being routed to the good ear, CROS. If you have a bicross, it means that the good ear also needs it to be a hearing aid as well as a microphone pickup for the CROS signal. So a cross means that you have normal hearing on one ear and dead ear on the other. A bicross means you have a weaker ear, but a better ear that needs a hearing aid and a dead ear on the other side. So that's what cross and bicross mean.
Oh, so Bicross for 2 years. Yeah.
No, so bicross is hearing loss on one side, dead ear on the other. A cross is hearing aid pickup, no amplification, dead ear on the other. So you're still wearing two devices in both scenarios. It's just dependent on whether or not the better ear is totally normal and all amplification is turned off, or that ear needs help and it is turned on as a hearing aid. But the system is exactly the same. If it's a cross or a bicross, it's only up to the audiologist to turn it on as a hearing aid or leave it as a microphone pickup.
Okay, only Articon has this feature, or
no? Most manufacturers have it. Some of them, like I said, are more advanced than others. In the case of Videx has it in their older technology, the Evoke, but they have not made it yet available in their newer technology, the Moment. So that's why you have to look at which manufacturer has which features, at which technology. I mean, there's a lot out there. So that's why I'm saying they're not all the same. And you got to kind of weed out or talk
to insurance doesn't cover it, right? This Bicross.
Unfortunately, because it's a hearing aid and it's not part of the American Medical Association, it is not covered.
Oh, okay. Thank you so much. Thank you.
Okay, Edward, you mentioned you have single-sided hearing loss in the chat. Would you like to comment or ask any questions or just tell us about your experience or not?
Sure. So I believe my hearing loss was like maybe while I was 5 or 6 years old. But actually, the first discovery was actually when my fourth grade teacher just noticed my hearing learning wasn't great. So that's where I first had hearing aids. I had hearing aid almost for 30 years. It's been on and off. It's been a struggle at first with all the analog technology because all these beeps and bumps, and it's just very, very frustrating. Yeah, it's the first time. And then the last few years, I had the digital version of the hearing aids, which changes the way I think when I wear hearing aids, because I love it because they have all these functional features that doesn't bother me as much as it used to be the analog technology. Sorry, there's a fan here, maybe just cutting. So anyways, so I do have single-sided hearing loss on right side, which is my right ear. I have a moderate hearing loss on my left ear. So my question to you is that, is it okay just to wear hearing aid on one side? Because my audiologist told me that I just need to wear it on one side. I don't need to wear it on the other side, which is my right ear. What are your thoughts? And I do know that sometimes you may be struggle because, you know, as I always keep telling people, if you want to talk to me, make sure you are on my left side so I can hear, because you're on my right side, it's just my blind spot, kind of like, you know, when you're driving a car, there's a blind spots. So I keep reminding them that just make sure you're in front of me or aside on the left side of me. So what are your thoughts about if someone who has hearing loss, like total loss on your one-sided, do you still need a additional hearing aid, or is that just too much?
Well, what I tell people is this, right? Can I see better with one eye? Or if I had two eyes, but this one was a little fuzzy, do I have better vision? The brain is made for a dual system. The left ear hears to the right side of the brain, the right ear hears to the left side of the brain, and in real time, the two talk to each other and tell each other what's going on. So as much information as we can get up to the brain to try to give it more cues, the better you're going to do. So if you don't use it, you'll lose it. We know that. So if the brain is not getting auditory stimulus from one side, this side of the brain then starts to be redistributed. The brain says, oh, you're not using that? Then the ocular department says, hey, I'm going to take some of those neurons. And your tactile might say, I'm going to take some of those neurons. And so it's not that maybe auditorily you might be a little bit more deficit, but it's possible that some of the other neurons or senses start to become a little bit stronger, right? You start to get a little bit more keened in visually of what's happening because auditorily you're missing. On some people, that area of the brain just deteriorates. It just doesn't get stimulation. It can erode. So we've seen brain scans now through pupillometry, meaning we look at the pupil and see how much stress it's taking you to understand in speech. So there's ways to measure. So we always want to try to give you the most information for the least stress, right? So they have shown through the tests that wearing two is better than wearing one. So you have to decide though, do I wear one most of the time so that I teach my brain, yes, I heard that over there and I need to tell my brain I'm hearing sound, not always turning to the side that's strongest, right? You have to, that goes back to your therapy of teaching your brain and going through activities where you're localizing. We teach little babies how to localize, right? We say, listen, listen, where's the sound? Where's mama? Where's dada? Right? We are teaching them how to use 2 ears and listen and key in on where the sound is coming from. We take it as natural. We're supposed to just know that. And we don't. We learned it. So when one side is gone, the natural tendency is for the brain to only go to the stronger side. So when you put on a bicross and you're actually hearing from both sides, somebody's sitting over here and you can actually hear them, you have to go back and retrain your brain to say, oh, I really did hear from that side. Oh, it really is. So you got to give yourself that positive reinforcement. Now, it might be that the hearing aid isn't set right or the microphone's not working. I mean, there's other issues, but in general, you should notice an improvement when you put the microphone or the cross on the weaker side. And if you don't, I would say maybe something's not right with the hearing aid. Does that make sense? Yeah.
Okay, Ken Post. Unmute yourself. You need to, okay, unmute yourself.
There we go.
There you go.
Just a note in terms of hearing aid coverage, Medicare does not cover hearing aids, but there are some supplements that do. So don't just assume if you're on Medicare that you don't, unless that's all you have. You just have Medicare, but there's Medicare Advantage. Some of those programs do, and the Medicare supplements also do. So don't just assume that. Call up your provider and find out if you have something.
Good point.
Okay. Well, we are kind of rounding out the hour here. Is there any question anybody has, regardless of the topic? Hearing loss is the exception, with a hearing loss question of any kind. So it doesn't have to pertain to sudden hearing loss, because we got about 5 minutes, and maybe you've got something that's on your mind that you are looking for an answer. Okay.
I can ask a question. Would the group be open to meeting maybe quarterly for a social or something in person? It can be outside of this meeting time, but as a group, are people desiring to meet in person or not?
Yeah.
Maybe raise your hand or do the thumbs up if you're interested in that.
Actually, I got some ideas, and I think that we haven't met together since the pandemic started. And I think, and there's a lot of people who have not jumped on the Zoom train. So I would love to see everybody. What happened to Daniel? Did Daniel leave? Oh, he's not here. Daniel?
He's there.
He is?
Yeah, I see him.
Oh, there he is. Yes. Okay. So Daniel is a volunteer, was a volunteer for our in-person meetings. And I had about, at any given time, I had up 12, 14 volunteers, each one just having a little job. And I have not seen most of those people. And we work together very closely. So I would really, I'm in favor of having an in-person event that is not a meeting, just more of a social. So if anybody has any ideas, I've got a couple of ideas, but if anybody has any ideas of where we might want to do that, let me know. So I've been thinking about BJ's, And Polly's Pies has a room. And so there's different places. Right now, I was told at Golden Rain that I could not make reservations yet. They're getting ready to do it for clubs, regular meeting rooms. So it's open right now to the residents to have wedding receptions and, potlucks and things like that. But as far as a steady calendar for clubs, the two clubhouses that that would work well for us is Clubhouse 3, the Performing Arts Center, or Clubhouse 7. Clubhouse 7 in the main room has a hearing loop, so that would be ideal. Yeah.
Tony, does it mean that it won't be a Zoom meeting anymore, only just in person? Tony?
Well,
no, it won't be a Zoom meeting anymore?
Yeah, you're in Nevada, aren't you?
Yeah, I am.
Yeah,
that's why I'm just.
Yeah, you're not likely to come to an in-person meeting. Well, if we're having a social event, there would be no Zoom. But if we have an event that is in Laguna Woods in one of the clubhouses, I'm thinking about setting up a hybrid meeting where we'll have a meeting in person, and we can also have people join us on Zoom. So
wonderful.
I'm thinking about it.
Yeah. It would be very, very helpful.
What would really be helpful to me is because Laguna Woods does not provide technical assistance. If they have the equipment, they'll include it in the room, but it would be up to me and tech support. And Alan I love Alan, but he's up in Diablo Valley, California. So he wouldn't be available to help me. And so anyway, I'm open, and I'll put the word out and see if I can get some help and have some social events and some hybrid meetings with Zoom and in person.
Thank you. I appreciate it. Thank you so much.
Okay, Ken, unmute yourself.
Got it. I'm very technical. I'd be happy to help if you wanted someone to help with the doing a hybrid meeting. I'd be happy to help you.
Oh, that would be great. That would be great. Okay, I've already been to one here in Laguna Woods, and they just went farther than they needed to. I think it could be simpler than the way they did it. And anyway, so I have some ideas how it could be done, but yeah, help would be appreciated. All righty. Well, it's 12 o'clock. Unfortunately, we didn't see Dr. Jillian or Dr. Lynn. I'm disappointed in that, but they are cochlear implant surgeons. UCI does they have cochlear implant audiologists that do evaluations for cochlear implants, if that's something that you're interested in. They also can assist with Medicare approval, and they know what the requirements are, so they can help you with that. And Dr. Jillian is just wonderful. He's done so many cochlear implants in Orange County, and Dr. Harrison Lynn is usually assisting, and they're a dynamic duo. So, so much for that. And if you want information on how to reach them, please let me know. You can put it in the chat box that you want information. Or you can email me, Tony, Toni, at HLAA That's my email address. All right. So I hope this is the end of the heat. I hope we're getting there. I know that the little bit of wind we have with this heat is playing havoc with my hay fever. And so I'm kind of looking for some cool air and fewer hot hay fever breezes. Okay. Thank you all for coming. Talk to you soon. Thank you, Daniel. Anne, thank you so much. And I think she's gone. No? Okay. Bye.